In Good Shape, your health magazine on DW, featuring an interview with a different expert every week.
Hemorrhoids. We don't like to discuss this, but we all have hemorrhoids. They help to seal our rectal sphincter, but if they swell or if they get inflamed, they can cause a lot of trouble. And that's what I'm going to talk about with Dr. Siegel here at the Helios Clinic in Berlin-Buch.
Hemorrhoids are not a disease. Only if you suffer from them, you need a treatment.
Many patients don't even see a doctor because they're afraid of the exam. And about this exam, I'm going to talk with the proctologist, Dr. Siegel. Thanks for inviting me into your clinic.
Welcome.
So, how does this examination work?
The patient is positioned at this chair, and I will start with the examination with my finger. And we got a kind of lubricant with local anesthesia here. I will introduce the finger into the anal canal, and usually it doesn't hurt. And after that I use this anoscope, again with this lubricant and local anesthesia, and this is brought into the anal canal. This finger is removed and there's a light source connected, and you will see the anus and the proximate centimeters from the rectum above the anus.
And why is it so important to take a direct look into the rectum?
Most patients are afraid of hemorrhoids if they see some blood on the toilet paper or in the toilet, or if they have some itching or some problems with the skin around the anus. And mostly they are hemorrhoids, but there are some causes like cancer, which can be harmful and should be treated, and abscesses or fistula should be treated as well.
So if you see any hemorrhoids, what do you do then?
So it depends on the symptoms of the patients. Hemorrhoids itself, every patient and every human being has hemorrhoids, but the symptoms are the cause of a treatment. And if there are only symptoms like bleeding and there is a low degree of hemorrhoids, you can just use a conservative treatment, stool regulation to advise water intake and fiber intake, and to look after your habits to go to the toilet, so you don't have to sit for a long time and don't strain.
What about the creams you can put onto hemorrhoids? Are they helping at all?
They are not helping to remove the hemorrhoids. They just help to heal the skin, but you can use an ordinary baby cream or some zinc ointment to protect the skin.
Good. And if the normal regulation of the stool regulation and all the normal things don't help, the patient has to come to you and you do some definite stuff then?
Yeah, this depends on the degree of the hemorrhoids. We have 4 degrees of hemorrhoids, 1 to 4. 4 is the worst degree, and for 1 and 2 degree, type 1 and 2, we can use a rubber band or sclerosation. The rubber band works like this. This is a hemorrhoid. You are holding the hemorrhoid.
So this thing here imitates a hemorrhoid.
Yeah, this is the tissue, the swollen tissue. And you go through this anoscope, you put it directly onto, you suck there, and you put the rubber band.
Okay, so right now there's a rubber band which goes across this hemorrhoid. And how does it work then?
The hemorrhoid is cut off from his vessels and will die, so this tissue above will be naturally removed during defecation, and there is a scar which will fix the tissue above the anus canal. So
is this procedure painful?
So if you do it the right way, it doesn't hurt. The area where you suck the hemorrhoids, there's no sensitive nerves, you doesn't feel the pain there.
We've got a lot of viewer questions. Danish from India wants to know if hemorrhoids are inherited and if oily and spicy foods can make matters worse.
The first part, so there is no proven evidence that hemorrhoids are inherited, but some families know their father or grandfather had hemorrhoids, but there's no proven evidence. And with the spicy food, it's the same. A lot of people feel that it hurts first up there and then down below. But there was a study which showed no difference between people who ingested some red pepper and the other people don't, and both people feel the same.
Okay. Nita Shetty wants to know whether surgery is the best method to treat hemorrhoids.
So this depends on the grade of the hemorrhoids. For the lower grades, grade 1, grade 2, and sometimes even grade 3, the conservative treatment is best, and conservative treatment is the basis for all the treatment. But if there is grade 3 or grade 4, you can do surgery. There's the traditional excisional surgery, and there are some newer surgeries like stapled hemorrhoidopexy, but the best is the traditional excisional hemorrhoidectomy.
Right. Dr. Siegel, thanks so much for inviting me into your clinic. Thank
Welcome.
you.